The next paper by Dr. Enrique Barragan and Dr. Martha Cecina, titled Clinical Evaluation of Presbyopic LASIK Treatment in Hyperopic Presbyopes.
Good afternoon. These are my disclosure. I'm paid consultant for all these companies. I want to talk about Supracor. It's a new approach of technological perfect vision laser system. We are using this algorithm since the last year or so. This presbyopia algorithm is applied to hyperop, emmetropes, and myop patients. We have the full control of centration because we are using the 4D eye tracker of the laser. That means we are using X, Y, Z in rotation of the excimer laser. We can move the target, or we can use nomograms, and the center ablation is for near. On our studies for hyperops presbyope patients, it is a single-site prospective clinical study. We do a hyperop presbyopic patients. We treat only the non-dominant eye with Supracor and the fellow eye, if it's needed, with the standard LASIK for plan of distance target. This Supracor treatment is not FDA approval, but has CE market, so in Europe are using it in both eyes. We do a minor adjustment, the number of the initial cases. This is a monocular study, but we collect both eyes. We measure the vision with the vision tester 6500. There's a 6 months follow-up. In our demographic, we have 35 patients, the mean age of 50 years old. And refractive outcomes, manifest refractive range was between +1/4 and +325 and up to 2 diopters of astigmatism. And refraction during time, you can see after 6 months, are close to -3/4. And this is the refraction that we was expecting, because due to a monocular approach, Supracor in these patients are more near dominant range. In Europe, are more distant range because they are treating both eyes. So at 6 months, we have 77% of the patients see on the monocular uncorrected near vision acuity 20/25 or better. Binocular uncorrected near vision acuity, 86% of the patients are 20/25 or better. Monocular uncorrected distant visual acuity, 76 are 20/32 or better. And binocular uncorrected distant visual acuity, 100% of the patients are 20/25 or better. Monocular best corrected distance visual acuity, 90% of the patients are 20/20 or better. On the safety side, we have one patient that lost 2 lines, and it's because continuing with dry eye post-LASIK. On contrast sensitivity, we have a slight increase from pre-op, but it's not significant. We asked the patients about several questions. If they can read headlines, 89% of the patients said yes. Menus, 85, said yes. Short message, 82, said yes. Newspaper, 71, and package insert, 85, can do it. We asked about PC, working without glasses. 46% of the patients said yes. 11 said no, and 42% of those patients don't use PC at all. Watching TV without glasses, 100% say always. If they go again on the surgery, 100% of the patients said yes. On conclusion, Supracor for hyperop presbyope patients seems to be safe and effective. We have high patient satisfaction, even with it applying only in one eye. We have good spectacular independence, and we are keep tracking this patient that has 2 eye lost because of dryness. Well, I'm speaking as we are collecting the 1-year results, and we will be happy to present later. Thank you for your attention.